It's a privilege to have the nephrologist Dr. Siddhant Bansal with us today, who is presently working at Ojus Hospital, Sector 26, Panchkula, a subsidiary of Alchemist Hospitals Limited. It's a pleasure to have you here with us today, Dr. Siddhant.
Thank you, Ms. Shalu. Thank you for the kind words.
So today we will like to discuss about the kidney diseases. What are the functions of kidneys and why is it important for us to know about the kidney diseases?
So kidney diseases are a major health burden. Every 3 out of 10 people in general population will have some sort of kidney disease. It can also be called a modern day epidemic.
Oh really?
Yes. So the functions of kidney disease are that they help us in removing waste materials from our body. They also help us in producing hormones which control the blood pressure and help in producing RBCs in our body.
So what are the most common types of kidney diseases?
So there are 2 types of kidney diseases. In general, what we see most commonly in our OPDs, one is the acute kidney injury. So that is a kidney problem which happens within hours to days. The most common causes like dehydration, infections, renal stones. These are the diseases which are usually treatable immediately and are treated in the hospitals. So second comes the chronic kidney disease. These are the kidney problems which occur over months. So probably over the definition says more than 3 months is known as chronic kidney disease.
Okay.
So the most common causes being diabetes, blood pressure, glomerulonephritis, hereditary kidney diseases. So these are the most common types of diseases we routinely see in OPDs. And since these are chronic diseases, they form the majority of the kidney diseases in general population.
So what are the symptoms of kidney diseases and which people are at high risk of kidney diseases?
So surprisingly, kidney diseases, most of the patients, the disease is only known when they get tested for some other problem. So most of the times this is the incidentally detected problem. In early stages, the disease is usually silent, therefore it is known as a silent killer also. Patient might only have vague symptoms like generalized weakness, decreased appetite or some sort of swelling in the feet, which is usually neglected.
True.
So only in the advanced stages, when the problem has all surpassed the initial stages, then the patient starts having problem like breathing difficulty. When the fluid starts getting into the lungs, patients have decreased appetites, breathing difficulty. So these symptoms only come when the disease is fairly advanced. So it is very important that we should detect this disease early to stop the progression of kidney disease. Otherwise, the disease is very difficult to treat in the advanced stages.
And so which people are at risk?
So patients who are diabetic, hypertensive, who have renal stones or some sort of family history of kidney diseases are at increased risk of having kidney disease. So they should get themselves screened regularly for kidney diseases.
That means we should not ignore any of the problems in case we have.
Yes, absolutely.
We should definitely consult to a doctor, right,
Yes,
sir?
yes.
Sir, how can we tell that someone is having a kidney problem?
So as we have discussed, so usually the disease is very silent in the initial stages.
As you said, it's a silent killer,
Yes,
right, sir?
yes. So a simple blood test which checks the function of kidney disease, and the test is known as serum creatinine. It is a simple blood test. The report comes in an hour. And second is the urine routine test. We check urine protein and urine for RBCs. So these are the indicators of kidney disease. If someone is having raised creatinine, someone is having protein in his or her urine, or some sort of RBCs, there might be chances that he is having some kidney disease and he should get himself checked for the same. And the third thing is imaging. We also get an ultrasound for the patients having kidney diseases. It helps us to know the kidney size and helps us to rule out other causes of kidney diseases like obstruction, renal stones, or some sort of obstructive uropathy.
How can we protect the kidney diseases, sir?
So the most important thing to protect your kidneys is to control your blood pressure, have good sugar control, diabetic control, avoidance of painkillers like we usually take over-the-counter pills, Saridon, Brufen, Combiflam. These are harmful for the kidneys. Smoking cessation. If someone is smoking, he should definitely curtail his smoking. Fifth is uric acid control. Sixth is proper diet, regular exercise, maintaining his weight are the most important things by which one can protect his kidneys.
So, what are basically the treatment options in case any person is suffering from a kidney problem?
So, in the initial stages, we treat kidney diseases by treating patients' blood pressure. We have a target blood pressure goal of 130 by 80 millimeters of mercury. Second is good diabetic control. Third is avoidance of painkillers like Saridon, Combiflam, Voveron, which we usually take over the counter, which are harmful for the kidneys. Fourth is control of uric acid. Fifth is we give some medicines so that patient doesn't develop swellings. Sixth is we give some medicines so that patient's bones remain healthy, and some medicines are also given to maintain patient's hemoglobin.
So these were the treatments for the initial stages of kidney diseases. So what are the later stages? What is the later treatments for the kidney problems?
So we start the patient on these medicines during the initial stages. We tried to slow down the progression of kidney disease, but eventually when the disease progresses in the advanced stages, when these medicines stop working, we need to take additional help for maintaining the body health. So that includes the gold standard treatment includes kidney transplantation, where kidney transplantation is a surgery where a patient's relatives donates a kidney to the patient, and then this kidney starts working as a normal kidney in the patient himself. And the second comes patients who are not eligible for kidney transplantation due to various reasons. They are offered dialysis. So dialysis is of two types. One is hemodialysis. Hemodialysis is a in-hospital process of cleaning blood where patient has to come 2 or 3 times in a week for the procedure. And the another one is peritoneal dialysis. This is an in-house process where special solutions are used to clean the body using the patient's abdomen. So this is an in-house process which is done on a daily basis.
So the in-house process where the patient comes twice or thrice into the hospital, how painful it is?
So usually the procedure is pain-free. It is just a single prick, like we get a blood sample. So that is the amount of pain a patient has during a procedure. Some patients get their dialysis via lines. They have a neck line or a Paumacath line. So in that cases, the procedure is totally painless.
Okay. So are there any myths about kidney diseases?
So yes, so as any disease, kidney diseases also have lots of myths. The most common myths being, sir, are both the kidneys damaged or it is a single kidney damaged? Yes, whenever the creatinine rises, it's both the kidneys that are damaged together. Patient can live a totally normal life with a single functioning kidney also. So he will never realize patients are born with a single kidney and they live a totally normal life. Only when both the kidneys are damaged, then only the problem starts coming up. Second is the disease totally irreversible or totally reversible? Yes, there are few diseases where the kidney gets better, and there are few diseases in which the only what we can offer is slowing the progression of the kidney diseases. So it depends upon the type of disease which we are dealing with. Third thing, the most common myth is once the dialysis started, एक बार dialysis start हो गया तो वो lifelong चलेगा. It is also a big myth. So in patients who are having acute kidney injury, like patient is having some sort of infection and his kidneys gets damaged, so in that cases it is a temporary dialysis, single session or 2 sessions of dialysis, and after the infection resolves, patients are off dialysis. We had multiple patients in which we had to do a single or 2 sessions of dialysis because of some infections or some acute kidney injury, and after the dialysis, after the disease is cured, patients do get better and they don't need hemodialysis. Yes, in patients of chronic kidney disease where the disease is prolonged and it's been there for years, like diabetic nephropathy, hypertensive nephropathy or other glomerulonephritis, in that cases, yes, sometimes we need a regular hemodialysis. Yes.
Thank you so much, Dr. Siddhant. It was really informative, and I think so the normal lay people, the lay persons can come to know or understand what are the troubles, when one goes through a kidney disease. Thank you so much. It was a pleasure having you with us.
Thank you.